5 NCLEX questions of the day. The nurse takes care of a 54-year-old client on a medical surgical unit. Here is the H and P. The client appears fatigued, alert, and oriented. Has a history of seizures. The client wears eyeglasses to correct farsighted vision. Both pupils are 3 mm and reactive to light. The client complains of pain in the gums. The gums appear swollen and tender to touch. Vital signs are temperature 99 Fahrenheit or 37.2 Celsius, pulse 88, and blood pressure 110/82. Has a history of hypertension. The client also reports burning with urination and unable to empty bladder. Has a history of benign prostate hyperplasia or BPH. Keep the scenario in mind and let's review question number 1. The nurse reviews the client's scheduled medications and decides to notify the provider before giving. The choices are lisinopril, tamsulosin, and phenytoin, because the client is reporting, and the choices are fatigue, swollen gum, and burning with urination. This is a close or drop-down type of question, which is a cross between multiple choice and fill in the blank. The nurse wants to hold one of these 3 drugs because the client is experiencing an adverse effect of the drug. We know lisinopril is an ACE inhibitor because it ends with the suffix pril. ACE inhibitors are used to lower blood pressure, and the main adverse effects are angioedema and persistent dry cough. Tamsulosin is an alpha blocker that relaxes smooth muscles and is used to improve urine flow in BPH. Main side effects are hypotension and dizziness, and should not be taken with Viagra. Phenytoin is an anti-seizure medication, and a very common side effect of this drug is called gingival hyperplasia, which is an overgrowth of gums and may lead to swelling and tooth eruption. So the correct answer is, the nurse should notify the provider before giving phenytoin because the client is reporting swollen gum, which is a sign of gingival hyperplasia. Question number 2. Phenytoin is now held by the provider. Which interventions should the nurse implement? Select all that apply. We know that phenytoin is an anti-epileptic drug, so the client is at risk for having seizures when off the medication. The client should be initiated on seizure precautions, which include padding the bed rails. Yes. Ensure oxygen and suction at bedside. That is correct. Check IV access. Yes, IV access is needed if the seizure becomes a status epilepticus, which requires IV Ativan to stop it. Have restraints on standby. That is incorrect because restraints may cause harm during seizure and should be avoided. And there is no need to restrict the client's activities, but supervision of activities should be provided so that injury can be minimized when the client has a seizure. Keep bed in a low position is also correct. Question number 3. The same client needs to urinate. While helping the client to the restroom, the client reports having an impending sense of doom and having lip smacking. What should the nurse do next? A. Go get additional help. B. Continue to help the client to the restroom and have him sit down on the toilet. C. Assist the client to lay down on the floor and turn on the side with a pillow underneath the head. D. Loose clothing around the neck. The correct answer is C. If a client is standing while the seizure occurs, the client should be assisted to lay down on the floor and turn to the side with the neck slightly flexed, to help drain saliva from the mouth and prevent the tongue from falling backwards. Once the client is in a safe position, ensuring a patent airway becomes the next priority. If the seizure happens while the client is in bed, turn the client to the side and ensure a patent airway such as loosing any tight clothing around the neck, giving supplemental oxygen, and checking oxygen saturation. Choices A and B are both incorrect things to do during seizures. The nurse can yell for help but should never leave the client. Choice D is a right thing to do, but is not the priority. Question number 4. The client is now having a tonic-clonic seizure. For each intervention, select to specify whether it is appropriate or inappropriate. It is inappropriate to suction the client during seizure because the client could be clenching the teeth and forcing the mouth open, can severe damage. Give supplemental oxygen and monitor oxygen saturation are both appropriate interventions to prevent hypoxia. Restrain the client during seizure is inappropriate and can cause harm. Pillows can be placed under the head and pad the bed rails to prevent injury. Note the time when the seizure started is appropriate, because it is important to know when the seizure becomes a status epilepticus, which is defined as a seizure that lasts more than 5 mins or having more than one seizure within a 5-min period, without returning to a normal level of consciousness between episodes. Checking blood glucose is also appropriate to rule out hypoglycemia, which can cause seizure, and it can be quickly reversed by giving dextrose. Note the characteristics of the seizure is also appropriate, as it helps to classify the type of seizure and its appropriate interventions. Question number 5. The client will be discharged with lamotrigine. Which of the following symptoms should the client report immediately to the provider if it occurs? A. Nausea. B. Dizziness. C. Blurry vision. D. Skin rash. The correct answer is D. Skin rash. Skin rash could be a sign of Stevens-Johnson syndrome, which is a rare but potentially fatal skin reaction to medications such as lamotrigine. That's why lamotrigine requires slow titration to prevent that. Nausea, dizziness, and blurry vision are some of the common side effects of anti-seizure medications that may or may not need to be reported depending on the severity. Thank you for reviewing the questions with me. If you want to see more NCLEX questions, comment, like, and subscribe. Thank you.